Virtual Unit Peer Leader Annual Training has been developed in consultation with earlymobility.com. There are several training modules available to help you in your role as a unit peer leader. This one is on the roles and responsibilities of being a unit peer leader. A disclaimer, earlymobility.com does not endorse any vendor or product and does not sell any safe patient handling and mobility technology. The videos used for these modules are purely representative of the types of SPHM assistive technologies available. There are many versions of all the technologies that you will see in the videos, and we urge you to check with your Safe Patient Handling and Mobility Facility Program Manager to determine the model you have on your unit and in your facility. The roles and responsibilities of being a unit peer leader. You are the link between the research and the frontline practice. In the module, what it means to be a unit peer leader, there's a video showing you the tasks and the forces through the spine as they relate to safe patient handling or manual patient handling. What we see in those videos, and this slide gives us just a snapshot, is that when we are carrying out manual tasks, the loads through our spine are greater than what is safe and greater than the maximum tolerance of our spine. And what we learned in that module is that spinal loads repeated over and over and over again are what ultimately lead to the failure. And so by the time somebody hurts their back, they've already had hundreds or thousands of these small, quick movements that have loaded their spine and caused a little bit of damage and a little bit of damage and a little bit of damage. And it's where the term, the straw that broke the camel's back, came from. So the difference you are making is tremendous. At the beginning of the day, it's all about possibilities. At the end of the day, it's all about results. This is a quote from Bob Prosen, which is so apt to what you do as a unit peer leader. I want you to just reflect just for a moment on what it is about being a unit peer leader or UPL that you enjoy, or if you're a new UPL, what are you excited about? Perhaps you were told that you needed to be a unit peer leader. As you go through these modules, I hope that you will see the value that you bring through your knowledge and your skills to your teammates, your co-workers, your patients, your veterans, their families, and to your unit and your facility. As you go through this module, take notes on areas where you think you are strong and those where you feel you need a little bit more training. And then reach out to your team members to help you get stronger in the areas where you don't feel you have a strength. Succeeding as a unit peer leader requires that you know the equipment on your unit, your lifts, your slings, where they're stored, how and when to use the equipment, what to do if the equipment is unavailable or broken, who to contact for different problems, and to be able to sign off on your competency landscape or whatever format you use for your unit competencies to document that all of your co-workers have received training and can demonstrate competence and know how to use the lifts. Your primary role is to ensure that your co-workers on your unit know and can correctly demonstrate how to safely move their patients according to your Safe Patient Handling and Mobility SPHM policy. So when we think about PPE, on the left-hand picture, we see PPE that protects us against bacteria and viral pathogens that can cause us temporary or long-term problems with our health. Use is mandatory. On the right-hand picture, we see PPE that protects against mechanical forces that can cause us temporary or lifelong problems with our health. Use is mandatory. We must get to the same place with safe patient handling PPE as we are with gloves, masks, and gowns. And just as we would never dream of going into a patient's room if they have COVID or MRSA or an airborne disease without our PPE, we must not go into a patient's room and perform manual transfers without our mechanical PPE. You are responsible for training and competencies on your unit. Conduct and assist in staff training. Orient new employees to your unit or service area. Complete equipment competencies. Assist your co-workers with patient and family training in the use of the safe patient handling technologies as needed. Speak to your unit managers and your unit-based educators and to your clinical nurse leaders to know when there are new staff on your unit. And if you see a new face, get to know them. Introduce yourself and help them be successful on your unit with safe patient handling. Help make sure that they know every piece of equipment and complete their competencies as needed. And this is an example of an initial competency assessment record. Yours may look different from this, but find out from your unit managers and your unit-based educators or clinical nurse leaders what your competencies look like, where they are, so that you can be successful in this part of your role as a unit peer leader. You're also responsible to be a champion and an advocate for safe patient handling. We talked about knowing all the equipment on your unit, including bariatric equipment, less frequently used equipment. You will be the expert and the resource for your co-workers. Stay up to date on safe patient handling mobility techniques, research, new information, and help your co-workers stay up to date as well. Help them be successful using equipment through training, monitor their use, offer to help. Assist your facility coordinator with input about new equipment, problem solving, safety huddles. Help them understand if equipment is not available, if you don't have enough equipment, if it's not working. Communicate and network with the other unit peer leaders on your unit and also others throughout the facility. Ultimately, own your zone and don't be afraid of it. Embrace it. What you're doing is so very important and so valuable, but don't try to do it on your own. You have a team of others around you to help you. Use your resources, find out your team, and be part of that village to improve the care of your patients and the health of your co-workers. Whose job is it anyway? You may or may not have heard this story, but it's titled, Whose Job Is It Anyway? This is a story about 4 people named everybody, somebody, anybody, and nobody. There was an important job to be done, and everybody was sure that somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job. Everybody thought anybody could do it, but nobody did it. Nobody realized that everybody wouldn't do it. It ended up that everybody blamed somebody when nobody did what anybody could have. Confused yet? But this brings the point down. The message is clear. No one took responsibility, so nothing got accomplished. And so this is a very, very important message when it comes to safe patient handling and mobility of your patients. We need to be clear and delegate who is going to do what. And as the unit peer leader, you are the leader on your unit. Delegate these tasks, battery charging, delegate that to a specific person. If it's just kind of everybody or anybody's job, guess what? Nobody is going to do it. Be a unit champion. Lead by example. Live the vision. As a unit peer leader, people are going to be looking up to you to see what you do. You are going to be watched. And it's really, really important that you model the behavior that you want to see in those around you. Encourage your co-workers, be that motivator, that cheerleader for them, provide immediate feedback when they do things well, but also constructive input when they need to change. Demonstrate and practice best practices. Talk with your co-workers to understand what's stopping them. If they are reluctant to use equipment, it's a good chance that they perhaps missed the training. They might have been there in person, but maybe they were exhausted from a 12-hour shift they just completed before training. Maybe they were wondering if they come off of night shift and they're trying to do training before they go home. Maybe they're wondering if their kids got breakfast or got on the school bus, or if they're working a day shift and then they're doing training afterwards. Did anybody get my kids dinner? Are they in bed? What am I missing? If it's during training, if the training is during the day and we're pulling people off the unit, they're wondering, did anybody remember to get my patient off the bathroom? Did anybody take that call? Did I miss that call from the family? So be understanding. If somebody says they don't know how to use equipment, it doesn't matter why. It's an opportunity to step in that gap for them and say, I care about your safety. It doesn't have to be perfect, but just stepping up and caring and showing them how as many times as it takes for them to feel confident. People want to do well, but they can be easily discouraged. And that's where your role as a unit peer leader is so very important. Be persistent for the right, safe way to care for your patients. Let's do a quick knowledge check. As a unit peer leader, you should be the one doing everything on your unit to make sure equipment is always working and where it's supposed to be. Do you think that's true or false? Hopefully you said false, because really it really is a team effort. We just have to delegate which members of the team are going to do which activities and be clear about that. You see a new person on your unit. You correctly think, A, they're probably only here for a couple of shifts. I don't need to do any safe patient handling mobility training with them. B, they probably got trained on another unit. So, I'm not going to have to train them. C, I should check with them to make sure they know how to use all the equipment on this unit. Or D, it's the unit-based nurse educator or clinical nurse leader's job to train them. Hopefully you answered C. Anytime you see a new face, check in with them, even if they are only there for a couple of shifts. If you have a piece of equipment on your unit that they don't have, or the function of your unit is different from what they're used to, they may not be prepared, and we want to keep everybody safe on every shift. Make sure equipment is working and available. You will learn more about specific uses of equipment in the lift and sling module. But again, know what equipment you have and how to use it, where it's stored, where the batteries are. Know how to tell if your batteries are charged, and make sure that you have a process for charging your batteries. Track your slings. Take inventory of the types, the quantities, and the condition. Develop a process, if you don't already have one, for checking your sling inventory at least once a week. And if you are finding slings that are torn or worn, make sure they get taken out of service and let your facility coordinator or program manager know that you need to order more slings. Provide expertise on use of safe patient handling mobility to assist with care planning, including fall prevention, mobility screens, pressure injury prevention, and including safe, dignified care for patients of size. You might be the one that changes that experience for a patient of size from a horrendous and undignified and unsafe experience to an experience where they feel that they have been respected and dignified, and your team members have taken the time to use the right equipment to lift or move them safely, comfortably, and in a dignified manner. Know the process for daily inspections and preventive maintenance of your equipment, including who to call for service and how to place a work order electronically if a piece of equipment is not working. Provide input to your facility coordinator or program manager if equipment is not functioning or available, and provide input on new equipment for your unit as indicated. Attend your unit peer leader meetings regularly for face-to-face or virtual collaboration. Again, I want to stress you are not alone. You have a team, so utilize the resources that you have available to you. Attend UPL conference calls. Go to conferences if you have the opportunity. Get to know your facility coordinator or program manager. Help them to know if there are changes on your unit or additional equipment needs, or if you see something that you think would work really well on your unit, be an advocate and push for the right equipment on your unit. You know better than anyone outside of your unit how your unit works and what the needs are. So don't be afraid to let your voice be heard. Share best practices with your peers. Present training in a way that makes it attractive, easy, obvious, satisfying. That's how we know people change the best, is when training is all four of these things. Sometimes you're going to have to train several times on one piece of equipment till somebody gets the hang of it or gets comfortable with it. Provide feedback. Be specific with positive and constructive feedback. Celebrate successes. Reinforce positive changes frequently and be persistent. Let's check our knowledge again. Which of the following are ways to stay up to date on best practices for safe patient handling and mobility? A, attend monthly unit peer leader meetings. B, go to conferences. C, read articles. Or D, all of the above are good ways to keep up to date on best practices. I'm sure all of you answered in your head D. All of the above are excellent ways to keep up to date on best practices. There are different ways that you can educate your peers. It doesn't always have to be off the unit in a classroom. Do a quick 10-minute in-service at the nurse's station. Do just-in-time training. Come alongside your co-workers in the course of care. Grab a piece of equipment and teach them how to use it as you provide the care to get that patient up to the bathroom. Man the call bell. When you hear boosting help in room such and such, bathroom help in another room, help to bring in the appropriate equipment and show your teammates, your co-workers, how to do those tasks safely. Go to your monthly unit meetings, hold monthly unit meetings, and take a piece of equipment in. Ask for 5 minutes of your monthly unit meeting from your unit manager, and review a piece of equipment that is not being utilized or that staff are not comfortable with. And then upon request from your facility coordinator. You are also a teacher or a trainer. And there is another module on making the most of your role as an educator, effective educators. But I want you to reflect for just a moment and identify one strength you have as a teacher and one area where you can improve. Think about how you feel when you go to do staff training. Is there anything you're afraid of? Is there an area that you feel really strong and you feel really good when you do that activity? That would be a strength. Again, in the Effective Educators module, we go into a lot more detail about specific ways that you can really be the best educator you can become. Some of the traits, think about this in other educators that you have had experience in learning from. Positive traits, are they passionate about their subject? Are they dynamic? Are they knowledgeable, positive, enthusiastic? Do they vary their voice inflection? Are they interesting? Do they know what they're talking about? Are they receptive to questions? Do they actively listen when you have questions? Do they use terms that are understandable? Do they make learning relevant to you? Do they make it fun? Some of the negative traits, and we all know educators that have lived in both of these columns. Do they speak in a monotone voice? Are they uninterested in the topic? Do they lack confidence and have poor eye contact? Do they seem to read all the material? Do they seem to not know the material? Are they unwilling to answer questions? Do they go too fast? Do the information seem robotic and irrelevant? Are they unable to hold our attention? Are they boring? Are they lecturing? Do they listen? Right, so demonstrating a little bit of some of those traits. How many of you fell asleep, even in those few things in monotone? Consider these traits and then reflect in yourself as a unit peer leader. Do I have any of these traits? And if not, can I work on more of them? Can I get more confident in the equipment so that my confidence projects to the people that I'm training? Implement and sustain the program on your unit. Inventory we've talked about, laundry processes, preventive maintenance of your equipment, annual training and competencies, audits, injury reports, safety huddles. Attend your unit peer leader meetings, work with your facility coordinator and program manager to resolve challenges. You're going to come up against challenges. If this was easy, everybody would do it and we wouldn't need a unit peer leader, right? But these things we're talking about can be the difference between a successful program on your unit and one that you just are struggling and feeling frustrated by. And the more of these pieces you do well, and you enlist the help of others to help you do well, the more fulfillment you will have from your role as a unit peer leader. Use the 5 whys to get to the root of the problem. Why did somebody get hurt? Well, they didn't use the equipment. Why didn't they use the equipment? Well, they didn't feel confident with it. Why didn't they feel confident with it? Well, they were off the day we did training. Why didn't we come back and train them? Because we didn't have a system in place for catching people that missed the training. We didn't have that redundant safety or that extra class. Again, it might be any number of whys, but the 5 whys is a method that has been shown to get to the root of a great number, the vast majority of your problems. So there's usually a deeper reason, a system level reason why bad things happen. And it's important to look at the system and not blame the individual who didn't use the equipment. There may be a very good reason. It might be that the sling wasn't available. It might be because your laundry process is not in place and all the slings were out in laundry. Maybe they didn't come back from laundry. Maybe somebody threw away a sling and didn't tell anybody. So we thought we had slings and who knew we don't have slings. Mitigate problems before something worse happens. So in high reliability organization, we talk about weak signal, strong response. You may be familiar with the visual of the Swiss cheese and the holes in the cheese. As a unit peer leader, if you notice something that just is off, take care of it right away. It might be a ceiling lift or a floor-based lift that kind of makes a funny noise. Don't ignore that. Have your biomed come up and look at it right away. It might be a strap that looks a little bit frayed. Don't ignore that. That could be an injury waiting to happen. If that gets a little bit more frayed, that could drop a patient. So small things, large response, really pay attention to those, because your role as a unit peer leader can literally save people from massive injuries, whether it's the veteran themselves or the caregiver assisting them. Make opportunities to plan for systematic resolution. This is where you involve your team, your biomed, your facilities, your unit managers, your facility coordinator, program manager. Pull the whole team in to plan for systematic resolution. Share perspectives. Perform post-injury briefs, near-miss briefs. Focus on solutions and processes, and work on effective team building. So before injuries occur, think process. What happened to threaten the patient or staff safety? What should have happened? What accounted for the difference? What corrective actions should be taken so that the same outcome could be avoided, or the same near miss can be avoided the next time? What's the follow-up plan, and who is going to be responsible? Remember that everybody, nobody, somebody, anybody. Delegate, be specific, and follow up. So this slide shows you an example of a safety huddle guide. Yours might look a little bit different. Ask your unit manager, your facility safe patient handling program manager, or your clinical nurse leaders what your safety huddle guides look like, and make sure you're familiar with them. Examples of near miss opportunities, we talked about a couple already, but failure to use lifts, sling or lift in not in good working condition, failure to ensure work orders are placed, batteries not charged, unavailable slings, failure to check slings before and every time you use them. Let's do another knowledge check. All of the following should occur during a safety huddle, except A, ask 2 whys to get to the root of the problem. B, discuss the potential harm to the patient or caregiver. C, discuss potential solutions to the problem. D, focus on the system level problems rather than blaming the individual. Or E, include near miss injuries. Correct answer is A. We have to ask 5 whys to get to the root of the problem, not just 2. Everything else should occur during a safety huddle. Marketing and communicating your program. Think about how to spread the word on your unit. And this can be done when you roll out new equipment, if you have a new unit, or if you've got a lot of staff turned over. If you are in your role for some time and you've got a stable staff, people should already know what they should be doing. But every now and again, it doesn't hurt to do a blitz of what we should be doing as a reminder and a refresher. Posters, badge buddies, signage, reports, and successes. If you notice trends with near misses or injuries, or you're seeing more manual handling, or you're seeing more new people, these might be triggers where you know you need to do more marketing communication. Know your challenges, know your solutions on your unit. Some of the frequent ones we come up against are management support, providing time in your daily workflow to perform your role as a unit peer leader, promoting staff safety as a high priority on units. That's sometimes a challenge. Engagement, time to attend the meetings, time to accomplish the tasks to ensure safety. You need to speak with your unit manager to make sure that you have the time to perform your responsibilities as a unit peer leader. If you don't, talk to your safe patient handling program manager. Some of the solutions that you can come up with: teamwork. Establish who can help you with some of the tasks. Utilize people on both shifts. Use existing systems such as facility education systems, TMS, clinical skills to assign equipment or review videos. Track your activities to maintain lead status. Include on your proficiency. So make sure that you know exactly what you're doing, know your responsibilities, and track where you are struggling to perform that role, because the specifics are going to help your manager understand where your challenges are. We cover a little bit more detail on these types of situations in the module Crucial Conversations, where we talk about some of these challenges a little bit more detail. And you may be interested to watch that video or look at that module to learn a little more about specifics and wording, scripting, or ideas of what to say and how to mitigate the most frequent challenges that come up in safe patient handling mobility. Expertise. So just a quick pause here. And as you look at these different expertise areas, ask yourself, am I strong in this area, or do I need more training? It's really important as a unit peer leader to be truthful with yourself and understand and be transparent. You can't be good at everything. Nobody is good at everything. Patient care ergonomics, is this a strength, or do you feel you need more training? Patient handling mobility, challenging issues. Being a resource for care planning, falls prevention, early mobility, pressure injury prevention. Do you feel that's a strength, or do you need more training? Collaborating with your peers and facility coordinator or program manager. Assisting in safe patient handling program implementation and maintenance. Equipment super user, including bariatric or infrequently used equipment. Are you strong, or do you need more training? Providing input about new equipment. Any areas that you checked, I need more training, reach out and keep reaching out until you feel confident. That is going to help you feel fulfilled in your role as a unit peer leader. Safe patient handling mobility program success requires participation from both a skilled facility coordinator, program manager, and unit peer leaders. The facility coordinator or program manager is responsible for coordinating and monitoring the program in collaboration with other necessary departments and meet performance criteria and directives from the national directive at the facility level, and is the liaison between the unit peer leaders and the national program. As a unit peer leader, you are the liaison between the facility coordinator or program manager and your unit department. You are directly related to program effectiveness and outcomes on your unit. And you are empowered and accountable to own your zone. You're not responsible for the other units. You're not responsible for some of the national and facility level things. You are responsible for the safety and safe patient handling on your unit. And both of you critical to the program success. Both may represent multiple departments, and both are required to achieve culture change and program sustainability. You are the superheroes serving our superheroes. Never forget that. I want you to think about that just again for a moment. You are the superheroes serving our superheroes who have served us. Unit peer leaders truly are superheroes. We're going to include some of the traits of successful peer leaders that may show up in many of our most loved superheroes. And I guarantee they show up in you every day that you show up as a unit peer leader. You are Superman. The character trait of Superman was loyalty and duty to defend the good of humanity. Safe patient handling mobility truly is for the good of humanity. There is so much evidence for the effectiveness of safe patient handling mobility. Consider specifically the humanitarian good you are doing as a unit peer leader, and remember this when you're faced with challenges. You are Batman. The unit peer leader character trait of Batman is perseverance and identity. Remember that the identity of the person leading is less important than the cause or the mission. The cause and the mission are to keep everybody safe. And I think it was Abraham Lincoln that said, there is no limit to how much we can achieve if we don't mind who gets the credit. So that's so important when it comes to your role as a unit peer leader. The vision or the identity is the safety culture. Describe ways you can ensure that the mission of Safe Patient Handling Mobility is the identity of the program rather than the leader of the team. In what ways can you communicate this with your staff? You are Wonder Woman. The character trait is truth. Sometimes the truth hurts. We want to ask our co-workers for feedback, and none of us get it right all of the time. We all make mistakes. Have grace with yourself. Have grace with your co-workers. You are showing up every day and trying to make a difference, and so are your co-workers. Ask for feedback about your leading style, about your teaching style, and just be honest with yourself without getting critical about where you need to improve, because that's how we get better. Discuss examples of this in the two-way street of sharing the truth and what staff may share back to you as a unit peer leader. When we're open to that constructive feedback, it makes us so much more effective. You are Black Panther. The unit peer leader character trait is increased senses. Be aware of the temperature of Safe Patient Handling Mobility on your unit. Respond with strength and fearlessness to fix the issues that need to be fixed, that are within your control, and lend a hand wherever it's needed. What you're doing is amazing work, and you are literally giving back in the best way possible to those who have served and gone before us. You have many resources as a unit peer leader: competencies, processes, location of equipment, laundry processes, who to call if. Reach out to your peers, reach out to the other members of your team to help you to fulfill your roles and responsibilities as a unit peer leader to make the biggest difference for your veterans, your co-workers, and those superheroes that you superheroes are helping every day. Congratulations, you've successfully completed the module on roles and responsibilities of being a unit peer leader. We hope this has helped to increase your awareness of your own strengths and opportunities to improve in your role. We encourage you to connect with other unit peer leaders. We cannot say that enough. Discuss what you've learned, help each other strengthen your team through what you have learned. And thank you for your service to help give back to those that have served us.